hundiyajaj okhon isqi qitaqan manaywi tuyoqwan piteedi jajtaqtaqshuwi tsalutaqstaga porque qetqk'uj no sé matzaponxo o qetqk'uj no sé matzatzulmeltz'aj umi o porque chiwta'toj xaqb'i.
El cheque beneficio el servicio njoye te programa taqe e cuando tahul wetseloto 2017 mitiwitum el el cheque programa pero poco a poco el ni te lo que disfrutar el cheque el servicio entonces cheque.
Hi, my name is Alex Jumikinga. I was born in Ecuador. I moved to the US in the year 2000. Since I moved here, I noticed the presence of a lot of families from Latin America, especially from Mexico. But I noticed the increase of families arriving from Central America in the year 2015. Most of them came from the country of Guatemala. Access to resources has always been a challenge here in this part of the state because many of the families or many of the resources that are for families are not for certain populations. Sometimes, you have the challenges of language, have the challenges of providers that are not bilingual, or trilingual sometimes. So that increases the many barriers to some of these families here. When COVID hit, that was sort of a wake-up call for everyone in this county. Noticed that many families didn't have the information. They didn't have access to all those resources such as unemployment, such as food, and even to the basic PPE that was provided to the rest of the population.
In 2020, there was a seafood processing plant that had a COVID-19 outbreak that affected many people in the community. And Juntos en Colaboración started in response to that. The reason we came together was because we recognized that there was a need for information in languages other than English about how to get help, where to get COVID tests. And we started to hear stories of people who were trying to reach out for information and calling helplines, speaking the language that they spoke and being hung up on because there was no one on staff to be able to answer their questions in their language.
Many got sick with COVID, and some of them still have those, they're still suffering from those symptoms. And we know that families that some of them lost family members. It was a very challenging time.
And so our team quickly gathered. It included extension professionals from several program areas. We also worked closely with our public health department, who was the primarily responsible for the COVID-19 information. We worked with other health partners and a nonprofit called Olala Center. And we recognized that we needed to get communication out. We needed to get information out in the languages that people spoke and through different mechanisms that they were using. So one example is that many people don't write or read. And so we recognized we needed to get information out orally. So we did that through videos and audio files.
Era complicado porque había restricciones, pero teníamos que hablar con los participantes. Tuvimos la fiesta latina donde pudimos traer música, pero también tener vacunas disponibles, información sobre COVID. Era integrar estos eventos donde los participantes se encontraban. Así es que fue una manera de apoyar más la educación. Creo que es una manera muy efectiva de integrar salud con la área cultural, con la área social. Creo que estos componentes van muy bien de la mano.